So welcome tonight to Recognizing Twice Exceptional Children, Observable Characteristics. I'm Mark Hess, and I'm the president-elect of the Colorado Association for Gifted and Talented. And I would like to introduce to you Bobbie Jackson Gilman. She's an examiner, a consultant, an author and speaker, and associate director at the Gifted Development Center right here in Colorado, working with gifted children and their families since 1991. She's devoted to identify and ensuring a rewarding education for gifted and twice exceptional children. And with Dr. Dan Peters, she co-chairs the National Association for Gifted Children's Assessments of Giftedness Special Interest Group, which brings together specialists in the assessment of gifted children to determine best practices. Bobbie researches gifted testing patterns and assists publishers in the optimal development of major intelligence tests for gifted children. She was serving the emotional needs of gifted SENG's 2015 Healthcare Professional of the Year. And in her fourth book, Gifted Minds Empowered, Advocacy to Develop Gifted Children's Strengths, just published in 2019, Bobbie provides a comprehensive view of informed advocacy. And this book won the 2020 Legacy Award and serves as the textbook for the Gifted Development Center's advocacy classes for parents and teachers. So please welcome along with me, Bobbie Jackson Gilman.
Thank you, Mark. I'm here today to talk with you about a simple tool to explore weaknesses of something we developed at Gifted Development Center, GDC, in 2010. It all started with our director, Linda Silverman, wanting to do a twice exceptional conference for educators. And as she often asks, she said, "What do you want to know?" And they said, "Give us a list of things to look for." So that began our efforts to create a checklist for recognizing our 2E kids. And we tried to include the best questions we would normally think to ask in a clinical setting to explore something. So I hope you've downloaded this. The best way to see how it works is to fill it out with a particular child in mind. But let me talk with you about it. Who can it help? Well, I think parents who want to explore some kind of a worrisome observation, something isn't right, but you're not sure where to go with that. Gifted and talented teachers who might suspect a child is twice exceptional, but teachers typically are not allowed to share that information with a parent. But if you are a GT teacher, you can provide the checklist as a service to parents of all of your gifted children with resources for further evaluation. And I should say specifically, this is not for diagnosis. It's for next steps. What areas light up as requiring further evaluation with specialists? Teachers who are required to locate children needing RTI interventions in the classroom may appreciate this list of behaviors reflecting weaknesses in very bright children and how they look. These are kids who might need formal 504 plan evaluations or special ed evaluations. And we hope that counselors and psychologists like us will gain additional information for professional referrals. We now send this to all of our clients. It used to be just a tool for presentations, and it turned out to be a treasure trove of information. So let me take you through it. The first area is general characteristics of the twice exceptional learner. And so what we see here is where the twice exceptionality, both the giftedness and the weaknesses are seen together. This is the only area of the checklist that has this. And so what are we looking at? We're looking at anomalies, things that shouldn't be. This child is so bright this way, but struggles this way. Unexpected underachievement. Why can't this really, good conversationalist write? These are kids who have to use their strong reasoning ability to compensate for their weakness, and they often do it well enough to stay at grade level for a long time until they can't. But they fatigue quickly, they experience a lot of frustration. So here are our questions. And we ask you to check that either something is seen or not seen. So sometimes or often garners, the same. We don't want to know if it's sometimes or often. Either one. If it's seen, check it. If it's not observed at all, don't. So we have several about anomalies. Appears smarter than grades or test scores suggest. Has a sophisticated speaking vocabulary, but poorer written expression. Participates really well in class discussions, but doesn't follow through. There's no implementation. Has uneven academic skills, inconsistent grades and test scores, things that don't make sense. And I would tell you what we have learned through the years is never assume this is because the child is lazy, unmotivated, unwilling to listen. There's always a reason. These are kids who do well when given sufficient time, but may perform very poorly on time tests, which stress their ability to compensate. And they usually take a lot longer to complete assignments and homework than other students if they have a learning disability or some of these other things we're going to be talking about. They may study very hard before tests, get good grades on tests, but it's forgotten tomorrow. A typical learning disability problem. May have excellent problem-solving skills, but suffer from low self-esteem. We have sensitive, aware children, and being twice exceptional is destabilizing. They're aware that people think they're really good at some things, but they see where they're not. Excels in one area or subject, but maybe average in another. The mathematically talented child who has a reading disability or dyslexia. Many of these kids can perform well with challenging work, but struggle with easy material, like they're good at reading comprehension, but terrible at decoding words. They may be good at math reasoning, but can't remember their math facts. They may have wonderful ideas, but have difficulty organizing tasks and activities, executive function issues. Some of these kids have great facility with computers, but horrible handwriting, and they're very writing reluctant. Has a great, sometimes bizarre sense of humor and may use it to distract the class. Think Jay Leno with ADHD. Thrives on complexity, but has difficulty with rote memorization. Understands concepts easily and gets frustrated with the performance requirements, and fatigues easily due to the energy required to compensate. Fatigue accompanies so many of these weaknesses, and consider that kids are compensating full-time every day. So it isn't that when they're not doing as well, they're not trying that day. It's that anything can get them off their game. If they have a cold, if they didn't get enough sleep, it can really affect their performance and their ability to compensate. Then I want to look first at visual processing. And when we're talking about visual and auditory processing, we're not talking acuity. So not distance vision, 20/20, none of that. This is about how your brain processes the information that comes in. Are the two eyes working well together? And I chose this picture of the little boy way too close to a screen because we've seen a lot of that this last year. And it's caused vision problems and a lot of trips to developmental optometrists for glasses with bifocals to reduce the strain on young eyes that may be naturally farsighted. And often the glasses have a filter for blue light. These are some of the things we see. Struggles with reading. Yes, that can be a reading disability too. It can also be vision or both. Mixes up plus and minus signs, has difficulty lining up numbers in calculations, has difficulty copying from the board. These are things that affect how the eyes are working together. And And if you have, for example, a child who can't copy from the board, they can't change focus quickly from near point to far point and back without getting confused. Puts face close to the paper when reading or writing, skips lines and loses place in reading, the tracking problem, poor spacing when writing, tires easily when doing either, and makes what looks like careless errors and written work, assume nothing. What do we do about this? Developmental optometrists specialize in visual processing. These are different than regular optometrists or ophthalmologists. The specialization for the developmental optometrist is to look at processing carefully a number of visual skills, and then where there are weaknesses, to offer targeted vision exercises. Maybe the child visits the vision therapist once a week and then has some homework to do 20 minutes a day. But we've seen kids take off reading. We have seen children who struggled to copy designs with blocks. They had to put their fingers over the picture of the design because they couldn't tell where one block ended and the next began. But the next year after vision therapy, the fingers never come out and they score higher. So whenever we have a situation of a child who scores poorly in visual reasoning on an IQ test or verbal reasoning, we've learned to look at auditory and visual processing as possibly being the culprit in all of this, because they may score higher after therapy or intervention. Who has seen this child? This is the child who goes nuts with the fire drill or the flushing toilets or the vacuum cleaner. And central auditory processing disorder can again occur in kids with good auditory acuity. They may pass the hearing screener and hear, a normal range of frequencies, but they have a processing disorder. So again, the ears are not working optimally together in processing. Many have excellent hearing, but difficulty understanding auditory information when there's background noise. So many of them hear way too much. They hear things down the hall. They can't filter out things so they can hear what they want to hear. And it makes a big difference for them. This is the one that I worry about the most because it's missed the most. And if symptoms are seen, they're usually thought to be maybe inattention or the child won't listen or something like that. Does not seem to hear you, may need several repetitions before responding. This appears several places in our checklist. So just go with it. If you see it, check it. Mispronounces words or letter sounds, confuses similar sounding words like agent and ancient, makes grammatical errors in speech, misunderstands information. These are red flags for auditory processing weaknesses because our gifted kiddos are very precise and usually hear words and repeat them exactly right and sort of osmose good grammar. So it's unusual for them to show these problems without an auditory processing or processing disorder. Watches other students to find out what to do. It's what happens when you're not sure you heard it right. Does not pay attention when being read to or during lectures, has a weak grasp of phonics reflected in spelling and pronouncing unfamiliar words, has a loud voice, especially when there's background noise, responds better to directions when shown examples of what is expected rather than told what to do. And fatigue is a huge issue for these kiddos. Is exhausted after prolonged listening, particularly in the afternoon. What you get in a heavy listening environment for one of these children is a buildup of fatigue from morning through afternoon. And for most, they're spent by the end of their school day. And they can go home and not want any sound or have a meltdown or not want anyone to talk around them or want to go run around but not listen to anything. I just want to show you one very interesting case. We had a boy come to us at age 6, and on the WISC-4, he earned scores at age 6, composite scores of 112 in verbal comprehension and 139 in perceptual reasoning. Now, these are the areas where gifted kids normally score highest because they're heavily loaded for abstract reasoning ability. And you can see in that blue column, I've actually given you the mean scores from a huge NAGC study that we were part of 390 gifted children. And that's what the mean scores were for these areas. So they scored highest in verbal comprehension and almost as high in perceptual or visual reasoning. And then a little lower in working memory, which is all auditory on this test. And then lowest in processing speed. That's the way these kids roll. But you can see that this child's verbal was really low. So we said, go directly for an auditory processing evaluation. His perceptual reasoning was 99th percentile, and he's up here about 90th percentile, or no, not even at 112. It's in the high average range, but it's not where we would expect it to be. So we got a call a year later from the mom, and she said, could we come back? We know you have to wait a year to redo an IQ test. Could you administer exactly the same test because we're seeing real changes? We want to assess the effect of the intervention. So naturally, I wanted to do that and asked all about this. And the boy had gone to Fort Collins to Able Kids Foundation, which has a remarkable filter that can help children prioritize sound and diminish background noise. And he had been a candidate for it, and they decided that they would get one because in the test where he was asked to recognize individual words with just enough background noise added to be like a typical classroom where no one is talking, he could only understand 68% of them correctly. With the filter in one ear, he could understand 92. So the parents got it. And the remarkable thing is, 1 year later, look at the difference in the WISC-4 scores. And on verbal comprehension, he got to questions he never got to before, much harder on the verbal comprehension subtest. So now he's 99th percentile in both areas. We expected the perceptual reasoning to stay about the same, and it did. But the verbal went way up, 22 points. That's a standard deviation and a half. And working memory on 2 short-term auditory memory subtests went from 99 to 123. So once again, you know, when we see a big discrepancy in reasoning scores on an IQ test, we look at auditory and visual processing closely. And sometimes we suggest to parents that they check those things out before they test. So this is actually the reference for the center in Fort Collins. It was established by a director of Colorado State University's Center for Central Auditory Research, pioneers in this field. And this has been a remarkable intervention. Let's look at sensory processing issues. This is another issue that comes up a lot, especially in kids who had long, difficult births, but sometimes when it runs in the family. Is a child clumsy and awkward? Has an odd pencil grip? Do you see that? Does not hold paper in place when writing? That's when you know the sensory integration isn't in place, when the 2 arms don't naturally work together to hold that paper in place. Has illegible handwriting and tends to resist handwriting. Is poor at sports. Is very sensitive to scratchy clothes or seams on socks. Gets upset when brushed against accidentally. prop self in chair because core muscles are weak, the kids that just kind of slouch over, becomes easily overstimulated and may throw tantrums, or low energy, tires easily, uncomfortable with crowds, difficulty with transitions, when younger had difficulty deciding handedness. That's often something parents want to check, and pediatricians usually know some good occupational therapists to do those evaluations. Attention deficit hyperactivity disorder. Yep, there's our kiddo. But you've already seen how visual processing, certainly auditory processing, that these are distractions for kids. They can also make kids look very inattentive. So you've got overlapping symptoms, and even experienced diagnosticians don't know sometimes what they're looking at until they rule things out. And we feel that doing that with the best specialists you can find is helpful because you believe them and you don't have to repeat it. But ADHD can be just inattention. It can be just hyperactivity, impulsivity, or combined type. Lucky you, you have it all. This is the impulsive types of symptoms. Has difficulty awaiting turn, acts impulsively without awareness of consequences, intrudes on others. That affects social skills. You know, your ADHD student starts tapping the boy in front of him on the shoulder, and boy, that's fun and can't stop. And the boy gets upset, but you know, the ADHD boy just can't quite stop. It's just so much fun. Is in motion as if driven by a motor. Some of these kids have huge needs for movement just to manage energy. Has difficulty remaining seated, fidgets. These are the more distractible, inattention ones. Easily distracted, which could be auditory, has highly variable performance on different days, which can reflect compensation, spaces out during assignments and homework, often not completing tasks. We sometimes test kids who you've asked a question and suddenly they're just kind of gone. So there are kids who really struggle to maintain the focus. Forgetful, may only remember part of an instruction. We do want to make sure they heard it all. Concentrates deeply only when interested, responds to partial information, thinking understands fully, complains of boredom unless work is novel, stimulating, or self-selected. Any gifted child with diagnosable ADHD needs a lot of challenge. They will engage best when things are requiring more of them, when the work is interesting, novel, something they really want to know about. It's a lot harder for them to engage and consistently focus when the work is too easy. So never make it easier. Looking at dyslexia, we love the work by doctors Brock and Furnett ID. I have a reference for their book at the end. And they describe stealth dyslexia in very bright children as powering through reading using high ability, reasoning ability, and contextual clues to figure out what's there, but with classic dyslexia challenges. So the decoding is never automatic. So does the child read at a lower level than expected for ability? Now, here's where if we know a child has a 130 IQ, we expect to maybe get reading that is scoring about 120 or 118 or 124, but not 100 average, which is grade level. But if you have a child with average reading scores, that's a red flag for a gifted child having a learning disability. Of course, you want to know about the vision, struggles with phonological processing and the learning of sound symbol relationships, auditory processing and vision are often part of a constellation of weaknesses with dyslexia, shows reversals, has trouble with right and left, has difficulty learning to read analog clocks, sequential and rote memory lack permanence. A lot of these kids do much better learning with visual, spatial, and kinesthetic techniques. Spelling and math facts may be forgotten after practice. Again, you know it today, but not tomorrow. If kids write the same word 3 times, they may spell each one differently, spelling it again for the very first time. Written output is more difficult than verbal discussion. And there's an auditory link too with related dysgraphia, where if there are auditory processing weaknesses, we expect to see more sequencing problems, which affect spelling or just putting words in a good sequence in sentences or writing paragraphs. Struggles to sequence ideas, anxious about reading aloud. That can be so embarrassing for these kids. What we see when they try to read word for word is they will often leave out small words, articles, tiny words they cannot visualize. It's not the words like submarine. And they may substitute words with similar meanings or appearance. You see them substitute maintaining context a lot because that's how they're reading. On to autistic spectrum, which includes the high functioning Asperger's syndrome. The DSM-5 has changed the terminology, and we don't have Asperger's syndrome, but these are usually very bright individuals on the spectrum. The main one here is the first one, struggles to read social cues, cannot adequately interpret the thoughts and feelings of others, or nonverbal responses, facial expressions, body language, what others are thinking or about to do, and does not respond appropriately to others' feelings. Rigidity is a big problem. Once a decision has been made, even if there are logical reasons to change it, it can be very difficult. Is inflexible about tasks, will only do them one way. Resists and or refuses tasks that are not like preferred or self-selected. Shows sensory issues. Now, we usually assume with a child with an autism diagnosis that they also have sensory processing disorder and ADHD. Usually that's the case, but clearly you can have sensory issues and not have autism. But pardon me, occupational therapy as the child is maturing can be so helpful for these kids. Experiences anxiety, particularly regarding social expectations, may have flat affect, may have difficulty with unfamiliar inferential language. Kids who take everything literally, they're very black and white. They don't quite get the joke or the pun. Has limited eye contact. Unexpected changes often elicit strong emotional distress, and limited initiation of social interaction and difficulty responding. Anxiety and depression is the last area. The first one is very perfectionistic. I need to separate that from perfectionistic, which goes along with the giftedness territory. But these are the kids who take it way too far. The work needs to be absolutely perfect. It must be an A+ or every item passed. Excessively anxious about tests, presentations, projects, grades, really uptight about things despite doing well and obtaining high grades. Paralyzed, almost unable to think at all when something is presented that's too difficult or it's heavily timed, until they can calm down and relax. Worries excessively about a variety of things: school shootings, bullying, dogs biting, climate change, whatever it is. can't let go of issues and fall asleep, fears going to school or avoids it, has phobias, burglars breaking in, whatever, obsesses about things. COVID-19 gave us a lot of opportunity to worry about that. Feels compelled to do things multiple times, obsessively, feels hopeless, worthless, or unhappy. Lacks or has lost motivation, has very poor self-esteem, and again, in very aware, often highly sensitive children. Makes statements about wishing to be dead or to have never been born, or makes threats of self-harm or has harmed self, absolutely require professional intervention immediately. Has a negative or gloomy outlook on life, expresses a lot of negative things. You need to check these things out and offer support. So these are the major resources, and I know this is going through this quickly, but this is the link for our checklist, and we would love to have you use it. Contact us first if you're working with a number of children for research purposes, but we'd like to know who's using it and how it's working for you. For the vision evaluation, there is this website that has a place where you can locate a developmental optometrist in your area. You put in the zip code, and you can even choose, check a box for a fellow with more experience than, I think it's an associate member. You'd also like to ask with any of these people if they've had experience with a lot of gifted children, because we're told that typically tests are given and they compare a child with average age peers. But if the professional has worked with a lot of gifted children, they're going to expect gifted visual processing. So if it's kind of in the low end of the average range, they would probably suggest vision therapy. Here's the Able Kids Foundation in Fort Collins for Central Auditory Processing Disorder. The ear filter has really been a real boon to children with this problem. It's been the thing that worked the best that we have seen. There are listening programs that we've seen mixed results with, but we have seen children improve in reading and spelling with those, some of the things that they can do, but we haven't seen any help for this speech and noise problem and being able to filter out what you don't want to hear. Sensory processing disorder requires an occupational therapist. A registered one is an OTR, and usually your child's doctor will have people to suggest. For learning disabilities, anxiety and depression, ADHD and autism, we really recommend you look for those professionals steeped in work with the gifted, because things look different. So hoagiesgifted.org, psychologist, has a list by area and even country. And the SENG Gifted website also does. The middle book here is Different Minds, Deirdre Levecki's wonderful book. She's an expert in working with gifted children, especially with ADHD and Asperger's syndrome, or high functioning, very high functioning autism. And she's done just remarkable work, and her book is very detailed. The Mislabeled Child is by Doctors Brock and Fernette Eide. They're the people I recommended for their expertise on stealth dyslexia. They also have a book, if you can see this, called The Dyslexic Advantage, that explains more about their ideas, but really good books with lots of case studies. My new one, Gifted Minds Empowered, has the chapters on twice exceptionality organized according to the checklist and goes back and forth. There are a lot of case studies there as well. And if we do this right, we change lives. We have kids who can truly develop their strengths and have their accommodations that they need for weaknesses. And this is where the sky's the limit for these kids. We see great things happen. So I hope you can use this and it's helpful to you in your life or where you work. So that's what I have. What questions do we have?
Yeah, and I would just encourage people to put questions in the chat, and I'll relay them onto Bobbie. First, I want to just say thank you for sharing this powerful, powerful tool, identification tool that makes sense to a parent. You know, put it right in their hand, right? And not only that, but easily downloaded. And we're not buying a book to get it; we've got it. Yeah. And I think there's really something to be said about that that's so important for the gifted community to have this tool in our hands so readily available. And I want to thank you for that.
Well, it's been surprising to us too. It's been very powerful. And, we have parents fill out a developmental questionnaire and we have diagnostic checklists, but this one always manages to catch more than we had before and to stimulate conversation, and it's helpful.
Yeah, and just it being in gifted education for such a long time, it seems like so often when the parents feel their child may be gifted, they're probably right. And just it's been my experience. Some teachers want to say, no, you're completely, but it's the other way around. Parents are so often right. And I really like how you started with, if it just seems like something is not right, then let's start looking at this checklist, because parents really have that innate understanding, right? They understand all the context.
Well, they do. They know if one child is showing something that siblings have not shown, or that the parents never showed. Maybe only Uncle Joe, with reading problems showed that. So parents do know. And, if you're talking about, symptoms and you go through them and a parent says, no, that's not what we see, we believe them. I mean, they do know. You want to get it right.
Yeah. I have a question here from one of the persons watching. If you're going through the checklist and it suggests that there might be an avenue to explore for further help, well, what would the next steps be? Would it be through a school evaluation or through a doctor, like a private practice? What would you recommend?
Well, that's a really great question. Often schools are not the first to pinpoint these weaknesses because kids are not performing below grade level. And since our last reiteration of special ed law, teachers have been asked to really look for those kids who are not keeping up with grade level classmates. And so these kiddos are usually compensating so well that these things can be missed. Now, it is possible, for example, if your child is really struggling with reading, to write a formal letter requesting a special education evaluation or 504 plan evaluation, which is not as extensive as special ed, but would allow accommodations for reading. And then the school will respond by doing some kind of an evaluation. I do think that it really helps to have that expertise with 2E children. So if there's a school psychologist available through the school who has that, really look for that person. Because these kids are not found by absolute low performance. Now, some of these things like auditory and visual processing are not usually addressed by schools. I think the Denver Public Schools did have a developmental optometrist for a while. I'm not sure if they still do, but typically in special education evaluations, they're looking at acuity. You know, do you have 20/20 vision, and are you hearing the frequencies to be in the normal hearing range? And these processing issues are not something that they look at. So it's a judgment call. I think a lot of times we end up having to do our own evaluations. And then I would say, look very closely, you know, to find somebody who has a lot of experience with 2E, a lot of experience with gifted kids, and they know what that looks like, and it can look a little different than more typical children.
And I would say that finding the person with that experience with 2E is not so easy. It's not an easy task. And so, and to look at those resource lists, and now that we've sort of figured out this virtual meeting world, I think that really opens up opportunities for people to find the sort of experts that they need that might not be available locally.
I think that's true, because I'm doing a lot of Zoom consultations now, and I've always felt that for my own child, I wanted to look a person straight in the eye and decide if I trusted them. So at least, you know, we get to do that. But it is a different type of experience. And I do see often that parents who are advocating for 2E children end up having to do their own assessment and a lot of their own interventions, but then get a 504 plan at school to provide classroom and testing accommodations. Things like use of a keyboard or extra time for reading, or even a reader or a scribe, whatever it is. But it often goes that way.
I have another question from one of our viewers, and I think this is probably about a general IQ testing like WISC or WIPSI, but when a child has been tested, for example, as a 6-year-old, is it recommended to have them retested again when they're older?
Not necessarily at all. Basically, we believe that IQ is relatively stable. If a child has specific weaknesses when tested, and then there are interventions and you see changes, then, you know, that's a good reason to consider retesting to get a better estimate of ability. And sometimes we have kids who, you know, zoom up to the top of the test, and we don't get a full reading of the full extent of giftedness, and maybe a second test on a different test or something with extended norms is helpful to provide that. But I would say that once you get the assessment that seems about right to you, it seems to describe your child, I would stick with it unless forced to do something else. It gets a little bit harder, you know, to capture the full extent of abilities when we have teenagers. It's certainly better than nothing, and we have norms for them, but we have a little bit more flexibility when they're younger. So it usually comes down to, if you really want to participate in some kind of enrichment program and they demand that you have a recent IQ test, and then you make that decision.
So many times identification is tied to programming, and we know that's not best practices, but it's part of the reality.
Yeah, it is.
We have a question here wondering about, do you know what the percentage of gifted children with an exceptionality might be? And are we catching, are we missing kids? What's your sense for it?
Well, you know, I can't answer that question. I've seen a lot of numbers, so I'm not sure. I'm not sure what to believe, but I do know that some of these things are very subtle and that we miss them easily. And I think right now with special ed law, especially tilted in the direction of finding the kids who are, well, in Colorado, maybe performing 2 years below grade level, that's missing a whole bunch of kids who are 2E. And the thing that concerns me also is that the way the compensation for weaknesses works is that they're working really hard to compensate until they can't. The demands of education become greater than their ability to compensate. And then what that means is you're discovering a child has dyslexia when they're 12 or they're 16 and they've done well enough until they got to the competitive high school and suddenly they're failing courses. And we assume that our twice exceptional children should at least be able to graduate from high school, go to college, probably graduate school with accommodations. But with some of these kids, when it goes so long and they miss opportunities for early intervention, and you find them so late, they're running out of options. So those are the ones I worry about the most. I think if you see something as a parent, you really want to look into it. The earlier, the better, but any time is better than never.
I still have some great questions here. We've probably got 5 or 6 more minutes if you're willing to take some of them. There's a question about services for a twice exceptional student. And should the focus be developing strengths or shoring up the weaknesses?
Oh, I love that question. All right. So here's what we do. Our goal should be to develop our children's strengths first, to emphasize the giftedness, while secondarily, and as gently as possible, accommodating and providing interventions for weaknesses. So without the emphasis on the strengths, it really messes everything up. If your child is going to go to school and the only thing that's going to happen at school is all kinds of, work to bring him up to grade level in these areas where he's struggling, and there's not going to be any attention to strength, you're going to have a child who doesn't want to go to school at all. So it's always strengths first. And I think too, when you're doing testing, you're doing some interventions to improve a weaker area, you want to make sure you have a really good balance, that your child has a lot of things they're doing that they love and do well, whatever they are, along with these other things where maybe they're doing their vision exercises. They need that balance, and be careful to never assume that, well, if I take away this thing they really want, they'll work harder and, they'll do better at this thing. There are always reasons. We just see them over and over and over.
I've heard too many times as a teacher, they're not doing well enough in my class, so they don't get to come to GT until they start doing better. And so we don't want that situation too. And I would just remind everyone that in Colorado, the advanced learning plan is specifically focused on strengths. So if it's only addressing weaknesses, then there's something wrong with that advanced learning plan. And take what Bobbie said to heart. There's 2 sides to it. But the advanced learning plan focuses on strengths, and it should reflect that. I think we have time for one more question here, and it's a question of clarity, a good question of clarity. So one of our viewers says, I was under the impression that differences in scores in the sections of an IQ test were authentic variations rather than evidence of a disability or disorder. If there are these gaps between sections, is that automatically a reason to look deeper?
Well, I wouldn't say there are automatically gaps between the sections, but I would say that whenever you test anything, it has different aspects. The way you test it has different aspects. And so, if you're testing something that a weakness is keeping the child from being able to reason through, then that's time to look deeper. And these visual and auditory things are are, really clear. We've seen a lot of this in testing. And usually when we're doing our initial consultations, we like to go through this checklist and other things so that if we really suspect something, we suggest parents might want to take a look at it before testing. But that's not always the way it's done. But it can make a big difference. Also, just a test that's timed a lot, like, the WISC-5 has more timing than the WISC-4. And our kids, our gifted kids, are not the fastest processors anyway. Processing speed is usually tested on these tests with clerical tasks. How fast can you do this thing with paper and pen? But anything that is timed a whole lot is not the best way to get it at their strengths. But if they have a weakness that's affecting vision, or their fingers and they have to use them, that just compounds the timing problem. And you get kids who score lower because either they can't meet the time limit, or they never get the bonus points for speed. But after an intervention, suddenly, they're kind of a different kid and they're not struggling the same way. Then you have a much better chance at really getting at that underlying reasoning, and that's what you want to know about.
And so I can translate some of that for Colorado. And so kids who are third, fourth, and fifth grade and above, when they take the cognitive abilities test, which is often our screener in Colorado, that becomes timed as they get older. Yes, and if you think about this score does not really reflect my child's abilities, then possibly you'll be seeking for an untimed test. And we do have those. We do have those resources. There's different tests that we can take that are untimed. And often is a big factor. Well, thank you so,
Mark, that's a really important point. And we actually have seen a lot of children who were turned down for gifted identification based on a CAGT or a NAGC nonverbal ability test. And they qualified based on an individual comprehensive IQ test, because you have different subtests, different ways to measure everything. You may have several different subtests looking at a similar area. And so you have different ways, timed and untimed, to look at it. But the timing is huge.
Well, thank you again so much for sharing that checklist. I've downloaded it and printed it. I have it in 2 different folders, so I'll never lose it.
And thank you for inviting me.
And thank you for sharing your expertise with so many kids, and kids who are gifted kids are hard to figure. And twice exceptional kids are really hard to figure. And so thank you so much for sharing all of that experience with us. We really appreciate it.